The Health Minister has today directly addressed the issue of safe staffing, dangling a carrot in the form of an accord in a direct bid to reassure nurses the government is meaningfully addressing concerns about their workload. Nurses are due to start voting on Tuesday on the latest pay offer from DHBs after walking off the job earlier this month for the first time in nearly 30 years. The nurses' organisation is recommending members accept the offer, but there's understood to be still widespread concerns about safe staffing levels. So today, Health Minister David Clark announced district health boards, the Nurses Union and the government will sign an accord on Monday designed to improve oversight of staffing levels in public hospitals. Earlier this afternoon, the Minister explained how that would work.
Up till now, it's been the DHBs who've been solely responsible for this. It will continue to be the DHBs and the nurses that are responsible, but the Director General will sign up as well to this. There'll be regular reporting to me on progress on this progress towards safe staffing, and the accord lays out a process where there's examination of how we're going on our safe staffing commitments, and the parties have agreed that this is a process that gets them to confidence around delivery on safe staffing.
Confidence. Given that bargaining with the nurses began last year, David Clark was asked why the accord is being unveiled now.
This is something we've been concerned about. We obviously made the commitment after the recommendation of the independent panel to put 500 more nurses towards safe staffing. But the concern has continued to be articulated in the media by the nurses, and so I sought to broker an accord so that we could actually get the parties to agree on a process to get to the safe staffing, because I think that's the issue we're hearing again and again, is concern about nurses being stretched and whether that's sustainable on the wards. And I, for one, don't think the current arrangement has been sustainable and can be sustainable into the future without some commitment by the parties to a process that gets us to safe staffing by the CCDM method by 2021.
David Clark speaking this afternoon.